NCCN Breast Cancer Conference has been held for several years now, and really it's a great way to get up to date on a number of things related to the management of breast cancer. One of the fundamental goals is to make sure the audience is clear on what the recent updates to the guidelines entail, and that may include things related to any of the disciplines that care for patients with breast cancer. So it may be related to radiation issues or medical oncology issues or surgical issues, as well as workup and genetics. We complement that with new data that emerges, and keep in mind that the reason that the guidelines are updated annually is really a reflection of the panel looking at the new data that emerges from different conferences, San Antonio, ESMO, ASCO, a variety of different sources, as well as looking at publications. And we take all of those things into consideration when we meet as a panel and make changes to the guidelines. So this symposium or this Congress is really an overview of all of those things and how they've influenced the change in the guidelines, as well as just general updates about the management of breast cancer. Well, this year we've seen a number of different studies be presented, again, at meetings around the world, most of them virtual by definition due to the COVID pandemic. So there haven't been as many people that are actually in the room, so to speak, when these data are presented. And with that in mind, we've heard data in a number of different areas, including the use of immunotherapy for breast cancer, not only in the advanced disease setting, but also preoperatively in patients with triple-negative breast cancer. We've also heard new data regarding drugs that have been approved for HER2-positive metastatic breast